Welcome to Iron Direct Primary Care and Integrative Medicine in Brevard. I'm here with Dr. Matthew Tinney, and today we're going to be talking about thyroid hormone optimization. Dr. Tinney, can you explain to us what the function of the thyroid is?
The thyroid is a endocrine gland that secretes thyroid hormone in a way that allows your metabolism to function. Essentially, it's the volume on your metabolism. It responds to every single cell in your body by engaging with your DNA, and it will regulate the function and the metabolism of each living cell in your body. So very important for brain function, right down to your toenails.
Mm-hmm. What are some of the symptoms of low thyroid function?
Low thyroid is just going to shut down your metabolism. So you're going to have a fatigue, probably some weight gain, maybe some hair loss, thickening of the skin, constipation, slowing of the nail growth, and mental fogginess is a big one.
Let's talk about some of the different medications out there. So a lot of people are on Synthroid or levothyroxine. And can you explain that difference between what we call natural desiccated porcine thyroids or NP thyroid, Armour thyroid?
Sure. Levothyroxine is T4. It's not an active hormone, and that has to be converted to an active hormone through an enzymatic process that cleaves off one of the iodine molecules associated with that. That in turn flips that on to T3, which is your active hormone. So T4, so the question is, why do they use T4 at all? Why don't they just use T3? Well, the reason is because T3 has a very short half-life. So if you miss a dose after 12 hours, you're going to bottom out on your thyroid function. So the T4 will sort of help you stretch that out a little bit, but not everybody is able to convert adequately. So with the desiccated or the NP thyroid, nature thyroid, and a couple other ones, they have both T3 and T4 in them. Now, the downside to that in some respects is that they're at a set ratio. All those combo medications are 38 micrograms to 9.5 micrograms of T4 to T3 in a 5-grain dose. So if you want to go up on one and not the other, sometimes it's necessary to separate those two. But nonetheless, I think you get a bigger response and a quicker response, and you don't have to worry so much about that conversion of T4 to T3 when you're taking the liothyronine or the T3 with it.
And that brings us to our next point, is laboratory evaluation. So we can sometimes determine if the patient is converting T4 to T3. Obviously, we base it off their symptoms, how they're feeling, but laboratory analysis that we can do here is very helpful, right?
Exactly. We're interested in knowing, first of all, what is the cause of your low thyroid. In some cases, it's an autoimmune disease. This is Hashimoto's thyroiditis, and it's the most common cause of low thyroid. And that needs to be evaluated because that can potentially lead to some other autoimmune problems if it's not treated. Also, the free T3, T4, we need to know how you're making that conversion. We need to know whether or not your metabolism is so cranked up due to other factors like cortisol or your adrenals that your body's trying to shut down your thyroid by pushing T3 back to T4. So we got to look at your reverse T3, and that will give us an idea what's going on there. That'll point us in a direction to some other chronic illness or possibly an adrenal superimposed function problem. And of course, there's some micronutrients associated with that T4 to T3 conversion. Selenium, zinc, a lot of your B vitamins, vitamin D, and not the least of which is iodine, which is very important for a number of other reasons, which we can discuss at another time.
Right. And so we can order this whole panel for about $22. A lot of people out there, they're just getting a TSH and they're dosing the thyroid medicine off of a TSH.
Yeah, I don't like to do that because it's a pretty wide range. Also, if you try to keep the TSH at the lower end, that also reduces your risk for production of more thyroid antibodies if you have an autoimmune component. We like to make sure that your function is, up to par, but we treat the patient, not the chart.
Correct.
So we want to check with the patient if they're having signs of hyperthyroidism, palpitations, the jitters, nervousness, things like that, then yeah, we may have to cut back on the dose. But some people just do better at a little bit higher T3 than normal. And if there's no downside or any side effect issues, then that's usually how we go with it.
Precisely. Some people, like for myself, I float around maybe a 2.8 T3. It's a bit suboptimal in my opinion, but I feel pretty good.
Yeah.
Other people, they feel lousy at 2.8.
Yeah, I have a couple people that are like that actually.
Right.
I have one lady, she's over 5. If she's not over 5, she feels horrible.
Wow.
So, and she does fine with it. She does great.
Cool. Well, that's all we have for you. Hope you enjoyed this.